I'm going to start with few symptoms and I'm going to intermittently give you cases to make you think that what you are learning, how that to imply in a clinical medicine. I'm going to start with hiccups first, very common symptoms, because there is very few medical treatment in the hiccups. So most of them chronic hiccups, they come to the homeopathic doctors. Now see, this is a very interesting case. This is a 65-year-old lady. He had a very mild to moderate epigastric dyspepsia, severe nausea. This is a vomiting case, not hiccups, vomiting. And she had a generalized weakness. Typical Marwadi lady, elderly lady, came to me. I examined, gave medical treatment, no relief. Again came back after 15-20 days. Doctor साहब कुछ फायदा नहीं है, no relief at all. Again gave medicine. 7 days later, साहब बहुत उल्टी होता है, बहुत vomiting होता है, can't help it. So I did upper GI scopy. Upper GI scopy was severe gastritis, very severe gastritis. Again changed my treatment, no relief. On examination, this lady had mild pallor. There was no icterus. There was no lymphadenopathy, no edema of it, no clubbing, but there was a large liver and large spleen and anemia. So large liver, large spleen, anemia, severe nausea, vomiting. I am not responding to all my treatment. One day she came slightly drowsy. Relatives came running to me. Doctor Sam, now she's become unconscious. I said, okay, please admit her in the hospital. When in the hospital, I was thinking in my mind, why nausea vomiting is not responding? So I thought of hypothyroidism. I thought of suprapubic hypothyroidism. Suprapubic means above the level of thyroid, that is pituitary. So I thought of central problem, pituitary problem. I got TSH, T3, T4 done, T3 low, T4 low, TSH low. Normally in hypothyroid, your TSH high and T3, T4 low. Your TSH also low. That means there's something to do with pituitary. So I got a prolactin level done and growth hormone level done. Growth hormone level very low. Prolactin level very low. I got cortisol level done. ACTH very low. So now this lady had a pan-hypopituitarism and she had nausea vomiting. So I had to put her on steroids with hypothyroid treatment. I started that. Second, third day, she started becoming conscious. She was better. She started eating food. But still I did not have my diagnosis about organomegaly. Large liver and large spleen. So we got a bone marrow done and it turned out to be myelofibrosis. So this lady had hypothyroid, but not hypothyroid due to thyroid disorders, it was pituitary disorder, and severe nausea vomiting was pituitary disorder. So nausea vomiting, you think of only gastritis, you think of ulcer disease, which was far above this. Now second, this was a medical student when I was a lecturer in KEM, and I remember this case because it was a very striking first case where I made mistake in my diagnosis and I learned that not every vomiting is GI. Student nurse staying in a hostel from poor interior of Maharashtra family, joined KEM hospital, lot of stress, couldn't study well, came with vomiting to GI OPD without anxiety neurosis, gastritis, so give treatment. No response. Again came endoscopy, gastritis, again started treatment, no relief. After 15 days, she was brought in unconscious state to the casualty. And the story history was, she was convulsing in a room, hostel room, and she became unconscious. So we all thought of cerebral pathology, we did a CT scan done, there was a large intracranial tumor. So the vomiting was not GI tract, vomiting was intracranial tumor. Why I'm telling you all these cases? Because come out of the vomiting, that means it's only GI tract. Vomiting can be anything. 2 days in practice, nobody is going to protect you unless you protect yourself. You give treatment for nausea, vomiting, and you take your homeopathic case, and if you're not aware there is a cerebral tumor, this patient becomes unconscious, and today, after seeing those Hindi movies where Sanjay Dutt walks into a hospital, hits the doctor and says, "You should be all right. If he dies, I'll kill you." So everybody started behaving that way. Doctors are the easiest target, soft target. Anybody can walk into the hospital and hit doctor, and nobody's going to do anything about it. So when you see a vomiting, You have to ask for basic investigations. Make sure that you're not missing out organic pathology before you start your treatment. Otherwise, if this person becomes unconscious, they'll blame your homeopathic treatment. And you will be, nobody will try to protect you. This lady had a really large intracranial tumor, and she was operated and she was sent back. She was removed from the nursing career. This I remember because very modern female staying at Pedder Road came to me in a tight jeans with her mother-in-law. Mother-in-law was wearing a mini skirt and a very tight, top, and both of them very happy, like age 3 people. This girl walked in, 15 days vomiting. I gave treatment. I asked her, by any chance, have you missed your period? She said, doctor, what are you asking me? I said, by any chance, are you pregnant? Doctor, not a chance, not a chance, not in a blue moon also. Impossible, I'm not pregnant. It's okay. I gave treatment. 5 days later, doctor, no relief, vomiting still continuing. It's okay. I changed my treatment. Again, she said, by any chance, are you pregnant? Doctor, just get out of that your mind. I'm not pregnant. Please take out of their mind. It's okay. I gave treatment. Lost. I never saw them again in my clinic. After about a year and a half, next to my clinic, there is a Kobe restaurant. I was going with some doctors there. Suddenly one lady got up with a kid in her hand. Hi, doc, do you remember me? I said, well, I think I've seen you, but you remember I came to you with vomiting? This is my vomiting. This is my vomiting. So I said, okay. I asked you that day, doc, I was stupid. I didn't realize I was pregnant. You get my point? So, right from pregnancy, intracranial tumor, metabolic disorders, endocrine disorders, everything is possible in vomiting. So don't think that vomiting is only reflux disease, vomiting is only gastritis, vomiting with ulcer. Now, vomiting has got 3 components. Component number 1 is nausea, second is retching, and third is emesis. Now, what are these symptoms? Nausea is very difficult to define. You can't define nausea, but it's a very unpleasant discomfort or feeling which is preceding the vomiting. And it has got a variety of stimuli that produces nausea. And any visceral pain of GI tract of any origin, whether it's a gallbladder or pancreas or small bowel or large bowel or anything, or liver, can produce vomiting or nausea. Any ENT disorder can produce severe nausea. Even a psychosomatic, which is very difficult to imply. So nausea can be produced by anything. And problem in nausea is that a gastric tone is reduced, gastric peristalsis is reduced, but tone of the duodenum and the proximal jejunum increases. And a transpyloric reflux of bile and food material takes place into the stomach. So entire stomach relaxes, duodenum contracts and produces transpyloric reflux. So that's nausea. You feel very nauseous that time. Retching is a very spasmodic and abortive respiratory movement with a closed glottis, which is with the time of respiratory movement of the chest wall and diaphragm. That means in retching, your breathing stops, your glottis contracts, your intercostal muscle contracts, your diaphragm contracts, your abdominal muscle contracts, but nothing comes out because your cricopharyngeal muscle also contracts and your G junction also contracts. So, antrum of the stomach contracts here, fundus and cardiac relaxes, and mouth is closed, cricopharyngeal sphincter is closed, which is very unpleasant. Retching is very painful and unpleasant. And then vomiting. Vomiting where the gastric contents are forcefully brought up and they are brought out of the mouth. Here, the cardia of the stomach is raised and open. So entire G junction cardia, it comes up like a funnel, it opens up, entire antrum and pylorus contracts, and there is a forceful contraction of the abdominal muscles, diaphragm, and all these things, the food material is expelled from the stomach into the mouth and outside. What else do you have with vomiting? You have increased salivations, you may have cardiac rhythmic disturbances, you may have a little bradycardia or you may have little sweating. Sometimes person may feel like passing stool with the vomiting, and some people do pass stool with vomiting. That is because the vomiting center and defecation centers are very adjacent to each other in medulla of the brain, and this is what happens.